Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. In this episode, join us for a conversation on retaliation in long-term care facilities. We will be talking to an ombudsman, a long-term care resident, and a gerontologist as we discuss how to identify retaliation, action steps to take when it does occur, and how to advocate to prevent retaliation from happening in the future.
Hi, everyone. We're so glad to be joined today by three guests here to talk about a really big concern in long-term care, retaliation. Retaliation and the fear of retaliation can prevent family members and residents from raising concerns about care and safety in their facilities, and it can have a chilling effect on reporting abuse and neglect in long-term care. It can take many different forms: psychological abuse, physical abuse, neglect, and it can sometimes be really hard to determine whether or not it's actually occurring. We are so glad to have Elon Caspi, a gerontologist who has spent years researching retaliation, who can give us an overview of the issue, as well as Tasha Jackson, an ombudsman from Connecticut who has worked on retaliation as an ombudsman, and Jeanette, a nursing home resident from Connecticut who can speak to her actual experience about how retaliation impacts people living in long-term care. And one thing I want to note before we get started is that retaliation is something that should never happen. And throughout our discussion today, particularly as Tasha and Jeanette talk about what this looks like in the real world, we really want to emphasize that it is never a resident or family member's responsibility to keep it from happening. That responsibility always lies with the facility. So just to get us started, Elon, can you give us a bit of background? I know you've done a lot of research around this issue on how common you think retaliation may be and what it tends to look like or how it tends to present.
Okay. So as someone who started working in the age field as a nurse aide in a nursing home, I believe that most aides, many aides are caring, compassionate, dedicated people. However, all too often they work in broken systems, frankly. And we know that there is often a gross asymmetry of power between residents and care staff members. A substantial portion of residents are physically dependent for meeting their very, very basic care needs every single hour. And whether it's using the bathroom, taking a shower, their food, their medications, many live with serious complex health conditions and physical and cognitive disabilities. Within this context, we know that many residents worry about retaliation when considering whether to express right violations, care concerns, or mistreatment. How common this issue? Well, we don't have a lot of research, but an early study here at UConn by Professor Julie Robison found that nearly 1/4 of nursing home residents in Connecticut nursing homes worried about retaliation if they were to report care concerns or a complaint. Additional 4% did not want others to get in trouble. In my current project, where I interviewed 47 ombudsmen from over 31 states, preliminary evidence, I'm still analyzing the data, but preliminary evidence indicates that this issue is prevalent and very, very serious. In fact, it is much worse and varied in its manifestations than my study that I concluded and published recently. The importance of this issue, I believe, stems partially from the fact that fear of retaliation is experienced by residents under varied circumstances and across many, many types of right violations, care concerns, and different forms of mistreatment. Unfortunately, CMS doesn't track it. Retaliation, and also the National Ombudsman reporting system doesn't track complaints related to fear of retaliation. It does track actual retaliation. Left untracked, in effect, it doesn't exist. So we can pause here, or I can at any point talk about how it may look like.
Yeah, I guess, Tasha, could you just, as an ombudsman on the ground, talk a little bit about how often you see it or how often you hear about it, I guess might be a better way to ask the question.
Well, as an ombudsman, we hear about it on a regular basis. Residents, whether their fear of even expressing concerns or just day-to-day getting care needs met, or if aides and staff come in with attitudes and residents feeling like they have to be nice to them or act a certain way because of the fear of retaliation. So we see retaliation and the act of retaliation done on a daily basis, from not answering call bells to not providing medication on time, not getting residents dressed, just some of the things that they residents, even getting other needs met, are they're not being done on a daily basis. Targeting, especially if residents are vocal and advocate for themselves and others. There's a lot of targeting going on, pressure to leave the nursing home. So we see retaliation in various ways, and it's one of the biggest issues that where residents don't report because of the fear of retaliation.
Right. So can I ask then, and anyone can answer this, Jeanette, including you yourself, because you might be the best situated in some ways. Some of the things you mentioned, Tasha, I think are quite clearly trying to get people to leave the facility, acting a certain way specifically to certain residents. Feel like, even as somebody who doesn't know much about the issue, as some people in our audience might not, like, I think a lot of people can identify that and say, okay, well, that sounds like retaliation to me. Some of the other things you mentioned are things that when I first started looking into this issue, I kind of sat and said, wait a minute. So, not answering call bells and not getting people dressed. I talked to a lot of nursing home residents for whom those things happen on a daily basis because of understaffing. So, how can we sort of tell the difference or sense the difference between whether or not somebody is being neglected because there's just not enough staff in their facility and everybody in the facility is being neglected, and whether or not this is personal and they're actually being retaliated against for a specific reason?
So a lot of residents in nursing homes have routine. So you have your long-term residents that have been there a long time, and they have routine. So if they like to get up at 8 or 9 o'clock, a lot of those residents have that routine already established. It's when that they're purposely not being dressed, or purposely not
Right.
getting up, being treated last when they normally are getting up at 8 or 9. So yes, there is definitely understaffing in a majority of our nursing homes, but residents who have been there long term do have routines. And when those routines are not being adhered to, whether something happened or and sometimes even collectively staff, because that person is advocating for themselves, or that resident being targeted, they they start doing little things, not anything to make it big so they won't get in trouble, but that's the little subtle things that they would normally do for a resident, they don't do.
Okay,
Yeah.
that really helps. Jeanette, I want to bring you into the conversation a little bit as someone who lives in a nursing home. Is this something you see and experience? Do you see it happen to yourself or to other people in your facilities, in your facility? What does it look like to you as somebody who lives in a nursing home?
I would first respond by yes, yes, and yes, all of the above.
Well, that's disappointing, but
It's disappointing, but I will say this. I personally, in my home, have seen where it has decreased. What, 10 years ago, I've been a long-term resident in my home now. In a couple of months, it'll be 16 years. So what I saw even pre-pandemic, okay, let's go there, where people were a little vocal, maybe 5% of the long-term residents were vocal about feeling neglected or rejected, or not wanting to do something because they're afraid that they'd get somebody in trouble or be in trouble themselves. I think because there's been better communication and more awareness made of what residents' rights are and what they're allowed to do and not to do, because there's been a higher impact with care plans being more personalized and residents being aware that that can be done, and be involved in it. Resident council meetings are now reestablished again post-COVID, which has really helped as co-president of the resident council here currently, and I can explain that. We hear a little bit about retaliation. Oh, I don't want to turn that person in because they're such a nice girl and I don't want to get them in trouble. But So that's when we have done here as resident council president is to address the administration, go to the nurse on the floor that's working there, say, hey, so-and-so's having this issue and it's a constant complaint. They're coming to me quite often with saying, so-and-so won't bring them water, or they come in and turn the bell off and don't say anything to them and don't do the care. And it's constant with this person, but this other person is so nice to me, but I don't want to get them in trouble. And I have said to them, please tell me, so then I will report that. And then we can address it with the administration. And sometimes it could just be education. The person doesn't know how to handle the situation, so they're just withdrawing altogether. Lack of communication to what is the real issue here? Is it a cultural thing? Is it a like or dislike? Is it attitude? Being able to address all that specifically helps you to alleviate and get rid of some of the fear of retaliation feelings that people have. I even heard a resident say recently, I don't want to complain to the kitchen because they send me something back. I don't want them to have spit in my food. Like there's that normal thought, and not that that would happen here, but on society at large think that way. You don't want to send something back at a because you're afraid of what's going to happen. So that just because you live in a nursing home, those feelings don't change. They're actually they become more heightened because your life now is in the hands of someone else, so to speak. I'm total care. So I don't I can't dress, shower, toilet myself. That is all done for me. I'm at the point now with my MS that I'm losing the ability to use my arms. So I'm also a feed most of the time, which it takes time and the ability to trust the person that is caring for you. And I think the communication is really key there in being able to develop those levels of trust with the people that are giving you care, to be able to say to them, hey, so-and-so is complaining about you. And they're saying this because, is there a problem? And how can we help you change this? Please go to the supervisor, talk to them so they can help you work through whatever issue you're having with these people on the floor. So I think communication is key for everything.
Yeah, that's really helpful. And I really like that perspective. I mean, I feel that way in a restaurant, right? Like if I am annoyed by something, I'm often quiet about it because you don't want to piss anyone off in your general life in many different ways. And, I've talked to many residents sort of about what it feels like for them when they enter their facility and sort of check their dignity at the door to some level. And when you are wholly dependent on someone else, that must just raise that level of sort of fear of how you need to behave and what you want to do, even if retaliation isn't necessarily going to occur, you just, you're dependent on someone else. Elon, can I turn back to you and just say, is this, the descriptions that Tasha and Jeanette have given of what they see and experience, is that sort of how you look at what this looks like in your research? Do you have other examples or?
It's so interesting because there, Jeanette and Tasha touched upon so many issues that we can open each one of them for an hour.
Right.
Take the resident council, take the care plan meetings, take the grievance process, and one of the things that was kind of left with me, because really the residents are the experts, is when Jeanette, you talked about the communication. And one of the themes that comes up in my current project, interviewing 47 ombudsmen, is that we are aware of the historic workforce crisis. We are aware of poor staff. We are aware of high turnover. We are aware of heavy reliance of agency staff. In this and lack of adequate training and respect for staff members. I mean, many times staff members are failing. They're being failed by their working condition. We know that. And that contributes to the issues. When Jeanette mentioned communication, one of the patterns that comes up in my current project is that in this environment that I just described, that you live in, Jeanette, when an experienced ombudsman like Tasha and her colleagues across the country coming in and slowing down and taking their big magnifying glass and say, let's slow down and let's see what's really going on here. Oftentimes, they can get to the root issue, and oftentimes it has to do with a gap in communication, a misunderstanding, And so they are in a very good position to help listen to the resident, support the resident, and mediate, negotiate, reach a certain direction in terms of care planning that the resident wants, because it's always, as Tasha will attest, it's always resident-directed advocacy. So that magnifying glass is something that is very, very important that the ombudsman have. I also want to add on the types of silent treatment. So you have mentioned the distinction between subtle retaliation, the more blatant. So we had this ignoring a resident. But on the other hand, I'm also seeing in my research and also in this current project, literally retaliatory psychological abuse, cursing, yelling at residents, but also physical abuse and the threats of retaliation. It's another big one. And another piece I want to throw into the conversation and let you take it from there is that oftentimes staff members may do or say something that in the eyes of the resident is being perceived as retaliation, reinforcing the need for ongoing education, which is hard in an environment with such a big turnover and high reliance on agency staff. But I'm going to pause here now.
Well, you bring up a lot of really good points, and I want to come back to the communication aspect because I do want us to have a conversation in a minute about, again, this is the facility's responsibility and what they need to be doing in this context. But in what you just raised, another issue that we internally were thinking about a lot at Consumer Voice as we started looking at this issue is that not all residents are similarly situated, and not all residents come into a situation and perceive things the same way, are treated the same way, and have the same ability really to advocate, Jeanette, as you describe yourself doing. Again, I talk to a lot of residents who are resident advocates who, when I've talked to them about what this looks like, they say, yeah, it happens, but I do this, this, and this. There are a lot of residents who, for whatever their backgrounds are, don't have a comfort level in really taking those steps and doing those things. And Elon, for those of us listening, I see you nodding. Can we just talk a little bit about that and how that can be addressed? And I guess it kind of does bring us back to the question of what facilities need to be doing. Jeanette, you mentioned your facility or things getting better as resident rights are really emphasized. I mean, to me, that's a key point, but what should facilities be doing to sort of prevent this from happening and protect all residents, even those who can't really advocate in the same way?
Yeah. Well, I think one of the main things that we need to remember is that, and I emphasize this a lot in other meetings that I've had, is that just because you live in a nursing home doesn't mean you're not a viable human being who has feelings and thoughts and goals. And some of our residents here are, say, dementia or Alzheimer's, or have mental health issues where they're not able to speak up for themselves. This is where the social worker and the CNAs and the nurses working on those floors have to be diligent in keeping an eye on these people, but watching them as they develop to see if there's a change of condition or if things change emotionally and even mentally. If they're crying more, then you need to get them out of their room or out of themselves with visitors or something like that for socialization. So yes, I agree. It is the facility's goal and job to make sure that each individual living in their home is happy, safe, and well cared for. But I think it's also the other people living around each other to encourage and be there for each other, just like you would, say, a sick neighbor across the street. Would you bring them a card or flowers? Or it's the same thing, being aware of the others that you're living with and become more community minded. Also having the CNAs, they talk and share with the residents so they know what's going on with individuals. But the big key again is communication, letting the administration know where the deficit is or where the positive is, and how we can continue doing the good things and then improve on the areas where there's weakness or somebody is, quote unquote, slipping through the cracks, to making sure that that does not happen.
Right. Thank you for that. Tasha, can we talk a little bit more about the role of the Ombudsman program and sort of what, sort of a two-part question, but what what ombudsman programs can do when they hear retaliation is occurring, because I do want us to address that. I also want to talk about what ombudsman programs can do to educate residents around the issue.
Yeah, so one of the things that as an ombudsman, what we hear as far as with residents and helping assist residents when there's retaliation in a facility, more than likely this person is doing it to more than one resident, right?
Mhm.
More than likely. So as an ombudsman, especially if the resident doesn't feel comfortable in disclosing who the person is, but I go around and kind of talk to other residents, especially if I know that where that particular resident is has residents in that corridor or wherever they might be assigned. And I talk to other residents and I kind of get a picture of, you know, how this staff member is treating them, if there's any changes. Tell them that I can also have what is called an ombudsman complaint. And so they don't necessarily have to give their name. But if I got enough residents that are giving me the information about the same staff member, I can say as an ombudsman complaint, this person is doing something. So I try to get a collective response from residents. And normally that's what happens. All of them are experiencing the same thing, whether that person is lacking in doing their work or whatever they're doing. Most residents will comment about similar situations with a particular staff member. So then I can address it that way. Some residents, we also empower them to advocate for themselves, because that really truly is our role in residents, and getting them to trust us enough to advocate for themselves, that we're going to be here, that they're not going to be left alone. So it's also connection with the resident and establishing that trust. Then residents trust you enough to care to tell you what's going on. And then as a whole, resident council is so important. We do a lot with our resident council here in Connecticut, and we have an executive board. We empower our resident council and to let them know what their rights are, and to empower them to go to the administrators, go to talk to other residents, because they're not alone. A lot of times they think they're the only ones going through this, but resident council is a really good way where we educate our residents. We sit in on meetings. They can ask us questions, scenarios, all types of. We tell them about the grievance process, and we try to do it quarterly, to at least get to one of our to the resident council meetings and be a voice for them. So when they do have questions, and also with the Department of Public Health, we pinpoint where there's retaliation, because again, that is key. Those findings from the Department of Public Health to shine a light on residents' rights and what is not being done in facilities is important as well. So collectively, we have a number of things we can do, but again, communication, education, most important, and empowering residents to be their best advocate. So.
Thank you. And I mean, I actually want to come back to, I mean, I feel like everyone here has brought up resident councils a couple times. So I want to come back in a minute, Jeanette, to talk to you a little bit more about that. But first, Ilan, do you tend to agree with that? I mean, I know you mentioned talking to ombudsmen throughout the country. Is that sort of your experience as well, and how ombudsman programs that are working as well as Tasha's program, is that what you're seeing and what they're doing?
Absolutely. They're doing a lot of things, and we're going to have a full report in September. I'm still literally just starting to analyze it, but they have a lot of things in their toolkits. And I think the resident-driven advocacy, the empowerment, the building the trust, which takes time, and the family councils as well. Some of the things that are coming up is how to detect when the resident is fearful of retaliation. And so, we are seeing ombudsman reporting when a resident is hesitant or reluctant to voice concerns, when there's a mismatch between the words and the intonation. Oh, things are fine when it sounds unauthentic, whispering, even when the doors are closed of the bedroom, sudden change in body language when a particular staff member is around or showing up, looking at the door or looking behind the ombudsman back to see if there's somebody there listening, avoiding certain staff members, even if it means, this is a real story, being soiled in adult depends for hours throughout the night just to avoid that particular staff member, becoming withdrawn, urging family not to voice concerns, and also retracting complaints. We're seeing that too. So and there's many other signs that I'm still collecting. I think one of the biggest things, I think that's what we started with, or I mentioned the gross asymmetry of power, and part of it is the isolation.
Yeah.
So a perpetrator of retaliation, or one that threatens to retaliate, such as evictions, or I'm going to physically abuse you, I'm whispering in their ears, which happens, is how do we break the isolation? I think Mayraid spoke with me about it last year. You know, the perpetrators, they're carving the person out. They're creating an isolation around them. So how do we in general, whether it's friends, families, ombudsmen, others trusted staff members, how do we break that isolation? So one of the ways is to find someone you trust, right? Whether it's another resident, whether it's a staff member, whether it's a manager, whether it's a non-direct staff member, a front desk, a maintenance person, somebody you trust, and then the ombudsman, of course. And then resident councils are really important. But one of the issues in resident councils that it's oftentimes some of them are run really well, and some of them there's a lot of issues with either residents not aware that they can have a right to have a private meeting, staff not respecting their wish to have private meeting, interrupting, controlling, influencing, taking minutes a certain way that does not reflect the real concerns, and not following through. And that's where the ombudsman comes in to help educate the president and the vice president of the resident and the resident about their rights in this context, because that's a critical vehicle, because it's powers and numbers. It should be a safe zone. And because it could be a group plan, and it doesn't single one resident out, and then they're targeted.
Right.
Well, can I ask a quick question, just kind of based on what you were talking about the isolation, which actually, Jeanette, seemed to me to go back to what you were saying about making sure that there aren't residents in your facility that are isolated in a variety of ways, you know, the whole, you know, staying close to people. But when you talk about like the perpetrators of retaliation, you know, we started off by saying, I think very accurately, that most staff are great. Most staff are not out there to necessarily retaliate against residents. How much of this, and this is also sort of an education, I guess, issue, how much of this in what you see, and maybe Tasha, you're best situated to answer this, is a staff member who, you know, is annoyed by a resident because they are working a long shift, because they are overworked. And it's sort of a situation where it's like, oh my God, this resident again, like they're frustrating me. I'm going to save them to last, just because that staff member themselves are coming from a place where they're exhausted or stressed out, versus it being like, oh, I hate this person. I can't deal with them. I'm going to make them wait until they're last because they piss me off. You know what I mean? Like there's a little bit of a distinction there. And I feel like in that first case, it doesn't take that much to say to that staff person, look, like we've had complaints that you're doing this, versus somebody who's a little bit more just, you know, I don't know if that makes sense, sort of that distinction, but somebody who's like actively retaliating against someone, versus maybe a more common situation, or maybe not, of exhausted, frustrated staff members who maybe don't get along with a resident for some particular reason.
So I think it starts off with, you know, a lot, what we're trying to help residents to do is in advocating for themselves, because the staff members are always saying, listen, we're short-staffed. They're constantly telling residents that they're short-staffed. And then when they say that, residents decline services and care needs that need to be met that day. A lot of residents will decline because they don't want to give them more than they already have to do. But we're empowering residents for their own safety to ensure that they're getting their care needs met. And so what will happen is residents, so these staff members are coming in, hey, I can't get you out of bed today. And after maybe the fifth or sixth time, the resident's like, listen, I'm getting out of bed today. And so then that staff member then becomes annoyed, right? And then now it's that you're doing something against me. You don't understand that we're short staffed. Now you're because you want to get out of bed today, you're doing this to me. No, I need you to actually do your job. And so instead of them looking at that, they look like the resident is targeting them almost, which is we're asking you to do your job. And so it comes this tit for tat, and then residents will report it like, hey, I didn't get out of bed. And so good administration will hold that person accountable. And so now they're being talked to with their administration. And so now the resident is getting the brunt end of it, because now they feel like if the resident didn't say anything, this would have never occurred. So I think they already come in overworked, already have high stress, whatever at home, whatever the situation, and they bring that to work. You know, I feel like the passion that years ago staff members had is not there, because they're required to do a lot more. And we have a lot more health concerns in our nursing home right now that you need extra staff, and they're being asked to do it with less. And so all of that, but it all falls on the resident. So I think it's a combination of both. And and you can't even distinguish anymore, because it's so, you don't know which one it is. It could be home life, or it could be just what's going on in the facility. So.
Right. No, I mean, that's really helpful. And I think the important part that you sort of mentioned is it doesn't really matter. The resident still deserves to have these things happen, and they still need to be living the life they deserve to live within the facility. And so, Jeanette, I want to come back to you a little bit, because you talked about how things have gotten better in your facility over the past decade, I guess. And I mean, you've already talked about working with your resident council and different things and good communication, but Tasha's talked a lot about resident empowerment. What advice do you have to residents who are dealing with retaliation in facilities? Like and not every resident, again, is similarly situated, and some can't necessarily take steps, but for those who can, or for family members that are viewing this, what advice do you have? Where do they start? And, what do you recommend?
I think I first would start with, if the patient is, say, making a complaint to a family member, and it's a constant thing, then the family member needs to go up and talk to the nurse or the nursing supervisor and say, look, my mom keeps telling me this, and this. Now, I know with her illness, maybe she's a little forgetful or whatever, but the fact that it's so consistent and she keeps bringing this to my attention, obviously this is something that's really bothering her. How can we help her? How can I help you help her in this situation? So this way, you're already starting off with making a connection, but it's a positive connection in your willingness to assist them, rather than coming from an attacking position, like this is happening, because it's really their voice against your voice. But if you bring it to someone's attention, I think that's the first thing, the open communication. If you don't feel that you're getting any response there, I'd go to the next level. I've made it so that I have a very good relationship with our administrator, our dean of nurses, the assistant dean of nurses, and the department heads. And as resident council president, I've also invited all of them to our resident council meetings at different times, so that the residents, know who the department heads are. So say they have an issue with laundry and they keep bringing it up and nobody does it, they know who's the next step to go to take care of this laundry situation, or who they might talk to about it. So I think it's building the level of trust. They have to trust somebody to share. And a lot of it is just being available. I think one thing that all people in society want, and this does not change when you come into a nursing home, is you want to be heard and you want to be valued. And you want what you have to say to be valued, because it's important to you as an individual. And we need to respect that. And thank God we're not all the same. I appreciate the diversity in my home and the way people do things. I am one of those people that like to learn. So I like to see different cultures, but also different responses so that you can help yourself, but also help others to learn how to respond rather than to react to a situation. And I always tell them, you get more with honey than you do with vinegar. How can we sweeten the pot here so that it's acceptable to you, but we can still attack the issue from a very positive position and give solutions? I always tell them when they come to my meetings, I don't want to hear complaints. I want to hear complaints and then solutions. What is your solution for this problem? And if not, how can we work together to find them? And I think that that's what you need to do, even with retaliation. I think one point we did not bring up yet, and I would like to kind of just throw out there, is that the retaliation is not always from the worker to the resident. Sometimes there's retaliation against the patient to the worker because of not, for whatever reason, not liking the way the person looks, whatever, and they're assigned to that person. And then the patient is mean and nasty to, bad language, swearing at them, they're trying to help the resident, and the resident is being the one that's being very difficult. So that's another aspect I hope you can do in your studies to see if you get more people that complain about that as well, because I hear that quite frequently. I have to remind our residents all the time, kindness is free, and you get better response with kindness than you do being nasty to somebody. So I hope that helps, gives a different perspective.
That helps a lot. And Elon and Tasha, do either of you, I think Jeanette, your advice is, again, you are the expert in terms of living with this and experiencing it and finding solutions for it. But Tasha or Elon, do you have any sort of final thoughts on empowering residents, on sort of handling this issue that you want to share before we close out?
Well, I just feel like this study is definitely needed. Residents, I think, if shining a light on retaliation and what all the different forms and how it looks, and educating residents on and being aware of it, I think it's going to be, residents will now have a voice. We do have a retaliation video, but I think in educating both the resident and staff, all, coming up with a component to educate the residents and staff, it's just going to be better for the residents, and residents will understand and have something tangible to view. They need something. A lot of times people learn differently, so they need to visualize something. That I have a home where they watch it every single meeting at the end, and they want something different. They like the different scenarios. So if we can come up with some kind of educational tool where there's different scenarios, there's education on it, interactive communication and learning will be helpful for residents as well. So I'm glad this is definitely being done nationwide, and hopefully the data will teach us how to be better for our residents, and how staff can be better for the residents. And just in Jeanette's point, yes, there is resident and staff, there are residents that become frustrated. It's their home. We all get frustrated in our home. We have to remember that these are the residents' home. And so there are times all of us get frustrated and in our homes, and the residents have a right to be frustrated too. And we want them to be kind, but they're going to have days where they're not so kind. And we have to be okay with that too, and be understanding. So.
Yeah. So I'd like to add to that. So first of all, thank you, Jeanette and Tasha. And Jeanette, you mentioned resident retaliation against staff. My understanding, there's a lot of issues with also residents who are saying racist things to our staff. It's really common. But I also want to add staff fear of retaliation. So staff often witness things, and they are fearful that their coworkers, supervisors, or managers will retaliate against them. And we know the background of a lot of nurse aides and how fearful it is, because they're dependent on the paycheck for single mothers, taking care of kids. So that's another piece. But I want to I think, Jeanette, what I heard kind of weaved in what you described is really when you look at the Webster dictionary definition of dignity, is all those things you mentioned. And I think we all want to aspire for dignified care. So what I would say, and that's a theme that comes up in my current quality improvement project with the ombudsman across the country, that it starts from the top. These are not my words. These are many, many ombudsmen. I am asking him, what are the characteristics of care homes that get it right? That get it? What separates them out? The first response I often get, it starts from the top. The culture. Is it institution-centered care or is it resident-directed care?
Correct.
Is the administrator uses the 30,000 feet approach, closed in some office that nobody even knows where he is, or some residents don't even know the name or how he or she looks, or someone who understands that coming to the floor regularly, talking with residents, asking them how they're doing, how we can improve things, seeing concerns as precious, truly seeing it as a precious opportunity for learning and improvement, and demonstrate, not just telling residents their rights. This is something Mered told me last year, demonstrating their rights, showing them that their voice really matters. And I think also we should mention social workers, even though there's issues with that, but social workers should generally be on your side. However, they are often between a rock and a hard place, and their paycheck is also coming from the care home. So it's not so simple. And assisted living, many of them don't even have a social worker. And even in some nursing homes, you don't have social workers. And so I just wanted to add that to the mix. But again, everything starts from the top, and making it very clear that there's zero tolerance for these issues, crystal clear about the laws, the regulations, the rights, and the consequences if staff retaliates against residents.
Well, I think that's an excellent way to sort of wrap up, Ilan, because I think you're right. Like when we talk about this, there is zero tolerance and residents do have rights when this happens. And I think, it goes back to, I think a thread through all of this has been that resident empowerment, and making sure residents understand that they do have rights related to this. And so I really want to thank all of you for being here today to talk about this. I think, as we sort of illustrated through this, it's such a complicated issue and there are so many parts that you can sort of, delve into and look at. But Tasha, it sounds like you guys are doing amazing work in the facilities where you are in working with those resident councils. And Jeanette, I think you are very inspirational to a lot of residents who might listen to this in terms of, what one thing you described that really struck me, because I hear this a lot, is that, you catch more flies with honey approach that you take. I think that's sort of, as you said, how the communication can kind of start by not being adversarial from the beginning. It can be hard. I mean, I sometimes think if I was in a facility, how I would react, and I would probably be angry all the time and frustrated if I was dealing with situations that you probably deal with on a daily basis. But that ability to sort of enable that positive communication really helps and makes a difference. So again, thank you all so much for joining us today. This has been really helpful.
Jocelyn, can I just give a shout out for the Long-Term Care Community Coalition's report last year on this issue?
Sure.
So last June, the Long-Term Care Community Coalition released a very comprehensive report called They Make You Pay: How Fear of Retaliation Silences Residents in America's Nursing Homes. It's free and accessible online, and it really kind of opens up the different forms of fear of retaliation, perceived threats, and actual retaliation, and some directions to consider. So I just wanted to give a shout out for that work. That was funded by the Long-Term Care Community Coalition based on my research.
All right. Thank you all so much for joining us today.
Thank you for having me.
Good to see you all.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on Facebook and Twitter, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.